yeah, so the talk is going to be recorded and then it will be later available on our YouTube channel. Okay, so if you missed this talk, if you want to rewatch it, you can always go to our YouTube channel and rewatch it later, or you can share it with your peers and colleagues. Okay, so it's 5:40 and I think we're going to start. Welcome everybody. It's a pleasure to welcome you in our second talk of the Translation and Interpreting Spring 2022 talk series, New Trends in the Profession and Research. Wonderful speaker, Professor Montalte. He's a professor from the University of Jaume I in Castellón in Spain. He will explain a little bit more about that. I really want to thank him, not only, of course, for sharing his knowledge with us, but because it's kind of late in Spain. It's like 6 hours later in Spain right now, so it's kind of like bedtime for for some people. So I really thank him for having access to like participate in this talk series despite the late time. So just a short introduction to Professor Montalte. He's, as I mentioned before, associate professor at the University Jaume I in Castellón in Spain. He has lectured and done research in translation studies with an interdisciplinary background since 1991. He designed and has been the director of the master's program in medical and health translation since the beginning in 2003. And excellent program. I was one of her students also back in the bachelor's, in the undergrad. So I can totally vouch for the program. His current research interests include medical translation, clinical communication in multilingual or multicultural translation and communication, medical humanities, Shakespeare and medicine, and translation. Research group Ghent or Hent, from the Universitat Jaume I. He has worked in 12 funded research projects since 2000. There are many other things on our webpage, but I don't want to take much time from the interesting part, which is the talk. So I think I'm gonna let Professor Montalte speak, and yeah, and everybody enjoy the talk. Thank you.
Thank you very much. Thank you very much, Dr. Laura Ramirez, for your kind invitation and presentation, and thank you to the Department of Spanish and Portuguese at Rutgers University. I will first of all introduce my university, which you can see in the picture. It is in Castellón, which is on the eastern coast of Spain, to the north of Valencia. In Spain, we have 4 co-official languages, plus other smaller languages which are not co-official, like Asturiano and Aragonese. So the 4 co-official languages are Spanish, which is spoken in the whole of the country. But then we have co-official languages in specific parts of the country, like Galician in the north west of the country, just above Portugal, and then Basque, which is a pre-Indo-European language, very old language, older than Latin and Greek, which is spoken right in the north of the country, in the Basque country and the north of Navarre, and then Catalan, which is spoken, as you can see, on the eastern coast, both in Catalonia and the Valencian area, where I come from, and the Balearic Islands, and also a bit of the south of France, southeast of France, in the Perpignan area. So I'm saying this because I come from a multilingual context, and I'm very interested in multilingualism and the coexistence of different languages. I myself am a speaker of Catalan. My mother tongue is Catalan, although I speak Spanish as well. And I will focus on medical translation, medical and health translation. So I'm going to give you a very brief overview, I will first of all refer to, give you some brief touches of history. I think it's important to learn from history. Then we will look at the scope, what we understand by medical and health translation, and we will also look at the specifics, the characteristics of this type of translation. Then I would like to explore some of the main tasks that medical and health translators perform in the marketplace, in their profession. I will also refer to some problems, some of the main problems that we deal with in medical and health translation. If there is time, I will try to explore a couple of problems so that you get a taste of the sort of challenges that medical translators have to deal with. And finally, I will try to sum up with some ideas about competencies. What do we need to learn to become professional medical and health translators? And then I hope we can have some time for questions and discussion. All right. Anyway, if you have any questions during my talk, just please interrupt me, and we can clarify any concept or respond to your questions. So historically, translation has evolved hand in hand with technological developments, often in a mutually beneficial relationship. Archaeological evidence shows that medical translation has existed since the oldest writing technologies, that is, cuneiform writing on clay tablets in ancient Mesopotamia, conventionally dated to 32nd century before the current era. Here, this is a picture of this sort of very old technology of the word, right? Cuneiform writing. According to the Cuneiform Digital Library Initiative, the earliest known medical text dates from the 3rd dynasty of Ur, that is 20 centuries before our current era, and is written in Sumerian. Other earlier, that is 14th century before our current era, Sumerian texts have been found at Hattusa, but it is not known if they were originally composed in Sumerian or copied and translated from Babylonian originals. Also of importance are the lexical sources for anatomical and disease terminology. These vocabularies were often bilingual, Sumerian with an Akkadian translation, beginning from the Middle Babylonian period. One of these vocabularies in Sumerian, Ugaritic, Akkadian, and Hurrian, languages spoken in ancient Mesopotamia, dating around the 13th century before the current era, and containing medical information in its pre-scientific form, together with other kinds of information in the areas of mathematics, agriculture, or city administration, might well be the first written piece of evidence of medical translation, which means that we're dealing with a very old type of translation spanning more than 3,000 years. In these more than 3,000 years, translation and translators have been a driving force that has contributed to the creation and also the circulation of medical knowledge. We will not explore all this historical dimension of medical translation, but I just wanted to say that this is a very old type of translation that has seen many knowledge revolutions, but also technological revolutions in these 3 millennia. Medical translation shares many features with any other kind of translation. It is a professional activity that involves understanding of the source text, developing mental strategies, applying textual procedures, or using information resources and technological tools. However, there are some characteristics that distinguish it from other types of translation, and I'm going to refer to them briefly. I think medical translation, medical health translation can be defined as utilitarian translation, that is designed mainly to achieve practical goals rather than to produce texts to be read for pleasure or entertainment. A key concept here is usability, and another important aspect of this utilitarianism aspect of translation is the consequences of errors and inadequacies affect people's lives and people's well-being, as we will see later on. It is a type of translation conceptually embedded in the fields of medicine, pharmacology, nursing, veterinary science, and other disciplines linked to healthcare and the study of health, disease, and illness, such as public health, molecular biology, genetics, psychiatry, psychology, but also complementary and alternative medicines, such as acupuncture, homeopathy, but also traditional Chinese medicine, and any other medicines coming from other cultures that may be involved in the communication in clinical settings. Each medical specialty has its own technical terminology, concepts and terms for anatomical parts, functions of the body, diseases, syndromes, drugs, medical equipment, and so forth are specific to medical translation. This medical knowledge accounts for a considerable part of what is communicated in the myriad situations in which medical translation may be required, covering not only communication among experts, that is researchers, clinicians, and so on, but also any kind of communicative interaction, oral, written, or multimodal, that involves health professionals, patients, their relatives, and the general public. Among the many settings in which communication and translation function in the biomedical and healthcare sectors are clinical trials, training health professionals, maintaining a specific medical device, disseminating biomedical research among specialists, transferring that research into clinical practice, making accessible to the patients the information they need to be able to adhere to treatments and manage their therapeutic processes, or circulating on the internet and in other media information aimed at enabling the general public to prevent disease or to respond to crisis situations, such as the pandemic we've seen, or we actually through. These communicative situations, which are very varied, are reflected in genres specific to medical translation, such as clinical case reports, research articles published in international biomedical journals, clinical guidelines for clinicians, or informed consents, or, for example, fact sheets for patients, or patient information leaflets. So there is a huge variety of contexts, situations, genres we need to deal with, we need to understand as communicative constructs in terms of formal conventions, in terms of how terminology is used in them, in terms of their functions in real situations, in real communication. Regarding users of medical translation, there is a great variety as well of possible addressees of our target texts: patients, biomedical researchers, health professionals, university students, hospital managers, technicians, manufacturers of medical devices, regulators, policymakers, media, and the general public, indeed. So we need to think of medical translation, health translation, both, in terms of who are we addressing, who are we writing for in our translations. And again, the possibilities are varied and complex indeed. And of course, we have as well a great variety of clients, ranging from hospitals, research teams that need to publish their results in international journals, pharmaceutical industries, a very big niche of the market, publishers that publish books, for example, textbooks, university textbooks for university students in the different specialties of medicine, international organizations like the World Health Organization, non-governmental organizations of all sorts. I'm thinking now of Doctors Without Borders and highly specialized non-governmental organizations that need translation. Media, just think of programs, interviews, for example, documentaries on medicine, health, biomedical science, and so on, and individual clients as well. For example, patients that need to move to another country or the need to get their clinical history translated. I would like to mention here as well new formats and media that make communication more accessible. So we need also to think and to introduce in our vision of medical health translation apps, for example, apps that deal with health issues and all different formats and media. I would like to draw your attention to this concept of genre that I've mentioned. So rather than thinking of individual texts as translators, we need to find the patterns that groups of texts share. We need to understand how these texts are highly institutionalized and highly routinized. For example, research articles, they follow a typical structure: introduction, materials, methods, results, discussion, and so on. A clinical case report follows a standard structure, is more or less standard length as well. Same with informed consent, which is a very widely spread genre in clinical practice. Every time we need to go through a surgical operation, for example, we need to sign these documents, and they also follow more or less structured pattern. We need to be aware of these conventions, these structures, also the length of the texts. Patient information leaflet is another one. It's another genre we normally translate in the medical and health translation sector. So it's really interesting. It's really useful to understand how these different genres are written, what their appearance is, what their conventions are. They help us to better understand the sequence of information. So once we've translated, let's say, 10 informed consent forms, we start to understand the standard structure of that text type, of that genre, and that is helpful. It is also helpful because it provides a contrastive knowledge of the same genre into different languages, because the same genre can be slightly different in the two languages we are working, and we need to be aware of this contrastive knowledge within the same genre. And this knowledge about genre helps us anticipate problems, resources, and solutions as well. From the point of view of how we deal with genres in the practical arena, I think they also help us understand the ethical principles that guide translation choices. Principles like accuracy, veracity, reliability, or confidentiality, they are shared by any text we're translating, right? But then other ethical principles like respect for minorities, respect for cultural orientations, or comprehensibility issues are somehow restricted to specific genres. So we need to understand the more general ethical principles and also the ethical principles that depend on specific genres. For example, when we translate informed consent forms from English into Spanish, of course, we have to be accurate. We have to be reliable in our translation. We need to keep confidentiality of the data there, but we also need to write a target text which is comprehensible, that can be understood by the patient who is going to sign that document. So this issue of comprehensibility is critical in an informed consent. Maybe it is not at the same level, it is not such a big priority in a research article which is addressed to experts who already have a lot of background knowledge that will help them understand that highly specialized register. So what I'm trying to say is that ethical principles, some of them are, shared by all genres we deal with as medical translations, but other ethical principles are more restricted to specific genres. And we need to develop that ability to link ethical principles, whether general or specific for each genre. We need to link those ethical principles with our choices when we write the target text. I just want to draw your attention to this idea of consequence. I mean, the ethical dimension of medical translation is important because when we don't resolve a problem properly, we end up with an error, okay? And these errors may have consequences. And this is just two examples of these sort of consequences. Knee prosthesis incorrectly implanted due to a flawed translation at a Berlin hospital in 2007. Prosthesis labels that were marked non-modular, cemented, had been mistranslated as cement-free, not requiring cement. Due to this mistranslation, 47 prostheses were implanted without cement, and this caused difficulties for patients' health. And another one between 2004 and 2005 at a hospital near Epinal in eastern France, where men suffering from prostate cancer received massive overdoses of radiation treatment. As a result, several patients died and dozens of other patients were also affected. The dose-defining software used for cancer therapy in the hospital was in English only. So the hospital administration relied on bilingual staff members who used the software. So this is just two examples of bad consequences for the well-being, even consequences provoking the death of patients. So our choices as medical and health translators can have a consequence, and this is precisely why we need to be very aware of the utility, as we were mentioning before, the utility of the text. These texts are meant to be useful in real contexts. Okay. Just to finish about the scope and specifics of medical and health translation, I would like to mention that quite often the quality of the original texts, the source texts that we translate, is not necessarily the optimum one. It's not necessarily the best one. Why not? The writers of these texts we deal with are, experts in the topic, in the subject matter of the text, but they're not necessarily always competent writers, competent communicators. That's one thing. The other thing is that many of them write in English as a second or a third language, which makes things also more complicated for them. So of course, many texts have a very good quality, especially those that have gone through filters in editorial processes, but a lot of gray literature, a lot of other texts that have not gone through quality filters, they contain inadequacies of all sorts that we need to deal with properly, okay? So instead of thinking of an ideal writer who knows what she or he is writing, who knows how to express herself, himself in the best possible way, as we find in literature, we need to have a different view of the source texts we're dealing with, all right? So in fact, in medical and health translation, I think we need a great margin for creativity and maneuver, because sometimes we need, when we detect that something has not been expressed properly, we need to make sure that this target text is comprehensible, is clear, is precise, is accurate, and so on. And that leads me to translation priorities. And I think in medical and health translation, of course, precision is very important, accuracy is very important, but also comprehensibility, especially when we're thinking of writing for translations for patients or for the general public, okay? As I was saying before, by medical and health translation, I don't understand only highly specialized texts, highly specialized registers. I include also any materials that are addressed to patients or to the general public, as happens in public health. When we think of the pandemic, we understand that public health communication is really important. Without adequate messaging, without adequate language for the general public, it's impossible to transmit, to circulate that specialized information that needs to be understood by everybody in the society. The other specific aspect in medical and health translation is medical information resources. We have plenty of medical dictionaries, web pages about medical information, journals, biomedical journals that we can access. So there's a vast variety of resources in medical knowledge, medical information that we need to explore and know how to use to solve our problems. And finally, I would like to mention the concept of interdisciplinarity, because we need to be in constant dialogue with health professionals, with patients, with health authorities, with researchers. Medical and health translation is a highly interdisciplinary activity. And in fact, quite a few translators, professional translators in this sector come from medicine, nursing, and other specialties in the health sciences. So it's a truly interdisciplinary social space, professional space, where we need to develop, skills, communicative skills, to be able to establish this dialogue with other professional communities. Now I would like to look at tasks. What do we do? What do medical and health translators do in the real world? I'm going to use this source of information. This is a study we conducted not long ago. We surveyed 206 professional translators in the fields of medicine and health, and this is what we found. Out. 100% of them translate, do proper translation, equifunctional translation. So they produce target texts that reflect the source text, full stop. That's the main activity, but 97% of them revise translations as well, translations done by other translators. So there's an interesting issue here of developing revising and editing skills for the medical and health translator. Copy editing, spelling, typography, style, and so on, is done by 74% of those 206 respondents. Terminology and document management, 62%. Reviewing content, and this is very interesting, 59%. So sometimes we are asked to review the content of a text, of a book, of an article, okay? Maybe for that we need the collaboration of somebody who's an expert in that particular field, so that whatever we do is really reliable, is truly reliable. Localization, 46%, which is also a very high percentage. Post-editing, machine translation, 44%. So this is a very important area, machine translation. We can discuss it in the questions and answers if you're interested. Teaching languages and translation is another of the activities that professional translators do, 41%. Adapting specialized texts for patients, and the general public. So we see more of this every day. Medicine is becoming more and more democratized. There is more and more focus on patient-centered care, patient-centered communication, and that means that highly specialized knowledge needs to be adapted for patients and the general public. Just think of the pandemic now. All the knowledge about epidemiology, immunology, virology, that has to be translated into society, that has to be circulated in society. This is a good example of how this highly specialized knowledge needs to be put in the style, in the register that lay readers will understand. Adapting texts to the Spanish spoken, written in different countries to a more neutral variety of the language. This is again a very important figure, 38%. This is of course more to do with regional and geographical varieties of the language. Selecting and recruiting translators or collaborators for teamwork, for big projects, yeah, that need to be done quickly with very short deadlines. Adapting texts culturally for the Spanish market. And here we find advertising in the fields of pharmacy, medicine, nursing, and so on, but also marketing studies done by pharmaceutical laboratories that need cultural adaptation, that need cultural accommodation. Project management, 28%. Writing original texts, this is very interesting. So from just a few ideas, just a few notes, some professionals are asked to write full original texts. Of course, this is done again in collaboration with researchers, for example, or teachers of medicine and so on, that need to write original texts. Editing texts, subtitling and dubbing, 23%. Mediating, interpreting in hospitals, 21%. So this is another big area, mediating in hospitals. Doctor-patient communication is a big issue here, yeah. Different cultures coming together, in an institutionalized context of a hospital, in a healthcare system, with its own norms, with its own expectations, where a foreign patient, a migrant, for example, has to be taken care of. And of course, here you have the cultural issue and the intercultural communication challenges. Adapting medical material to a different format for the same receiver, like, for example, adapting a research article into a PowerPoint presentation for a conference, yeah. So being able to select the sort of information that has to be reflected on the PowerPoint presentation for a conference. Creating content for websites, desktop publishing, 18%. Conference interpreting, this is another interesting activity of translators. They say that 15% of them have done conference interpreting in medical conferences. And finally, managing or creating content on social media such as Twitter or Facebook. When there is a conference, kind of feeds that have to be created and circulated in social media are sometimes done by translators. So translators currently, I think, face two great challenges: increasing automation and new human communication needs. In the era of machine translation, I think new communication needs are being created, as we can see. And beyond this idea of just translating, what we can see is that the there's a great variety of activities, of tasks that we are required to perform by our clients. Now I'd like to move to what sort of problems we deal with as medical translators, okay, medical health translators. For me, a problem is an obstacle in the translation process that cannot be overcome immediately, right? And that requires resorting to careful thinking and or external resources, documental, human, or technological, for aid. Some translation problems may go unnoticed, and this is problematic. When they go unnoticed, it means that they may end up in an error, okay? And as you know, errors quite often have consequences, and those consequences can be really bad. So there are many types of error, of problems that are found after many years of practice and teaching as well. So you don't understand the concept, for example, in the source text. And this is a very common problem. We don't have the background, the highly specialized background of the cardiologist, of the neurologist, or any other medical specialty, and then it's very difficult to, or if not impossible, to understand a medical concept, or you don't understand, or you don't know the equivalent of a term in the target language. There are conceptual and register asymmetries between the two languages you are working with. Polysemous terms in the source language, this is a very common problem, right? A word that has more than 2, more than 3, more than 5 different meanings, right? You need to understand which one of them is activated in that particular text. Ambiguous indeterminate words or expressions in the source text. This can be also a problem when a word can mean more than one thing at the same time, in the same context, in the same text. And when you translate that word, there is no way to keep that ambiguity, to keep that indeterminacy. And that's problematic as well. That makes us stop and think about it carefully. I will show you an example later on if there is time. Synonymous terms in the target language, right? So we have a choice of 2, 3, 4, 5, 7, 10 synonyms in the target language that are equivalent to the term in the source language. Which one of them do we choose? Sometimes it is clear because we need to address a specific audience. So if you're addressing patients, you will choose the term, the synonym that is more comprehensible. But sometimes more than 2 or 3 terms are equally comprehensible or highly specialized, and it's really difficult to choose. For example, another one is neologisms, for which there aren't any sanctioned equivalents in the target language yet. And this is very frequent in medical and health translation. You know, biomedical research grows quickly. A lot of publications are circulated every week, and new advances, new inventions, new discoveries are done. And this is reflected in language, in neologisms, new words, or existing words with new meanings, right? So this is another problematic area. Names of institutions in a particular country, or names of roles of professions and so on. It's another problematic area. Names of commercial medicines in a particular country. We have commercial names for drugs, and we also have non-proprietary names for drugs, and this is always problematic. For each of these, we could have a long session, 2 or 3 sessions, to explore all these issues with examples. Or for example, you're not familiar with a given genre, with a particular genre. For example, informed consent. You've never seen informed consent forms. And you're going to translate informed consent, so you need to become familiar with the structure. You need to become familiar with the register, and with the terminology used in that particular genre, or an administrative or legal difference that affects the function and or conventions of a particular genre. So we could move on to more problematic aspects of medical translation, like an obscure or ambiguous expression in the source text, not only indeterminate, but obscure because there is a lack of clarity in the writer of that text. It's not an intentional ambiguity. It is an obscure expression as a result of not being a competent writer. What do we do? Do we improve the text? Do we feel entitled and to produce a text that will be clearer? Or factual inconsistencies in the source text. I've seen them many times. What do we do when there is factual inconsistency? Of course, you need to deal with it properly, professionally, and inform your client and find out where the problem is and sort it out. Lack of knowledge about stylistic preferences of the client or the reader. This is another important problem. Or lack of knowledge about sensitive issues of a specific readership, right? If you're translating texts that affect, I don't know, women that have gone through cancer treatment. I'm thinking now of a text that I translated on sexuality addressed to women that had undergone cancer treatment. So there are many sensitive issues to do with sexuality, to do with the disease itself, okay, or the condition in which the readers as patients are in, or lack of knowledge about culture and values regarding health, illness, well-being of patients. And this is very important, for example, in the case of mediation between doctor and patient, when the patient is a migrant, for example, who is not familiar with the healthcare system, who has her own values, her own culture about health, illness, and well-being. So as you can see, there is a wide range of specific problems of medical and health translation. If there is time, I would like just to mention, I will give you the reference first. This is forthcoming. It's an article in which we look at different translation problems, yeah? And we analyze them carefully. And then we look at the sources of information available and we come up with a solution for these problems, all right? So for example, in the first case, adrenal bradycardia, hyperaldosteronism, ischemia, mitral, and so on. What my point is, these are all Greek and Latin words, yeah? You need to be aware that in medical texts, you find a lot of words that have Greek and Latin etymologies, right? This list of words I took from a book on cardiology, all right? And I would like to recommend this resource. If you're doing translation involving English and Spanish, for example, this is a very good resource to deal with etymology, right? With Greek and Latin etymology. It's a free dictionary published at the University of Salamanca. And it's a dictionary where you can sort out all these Greek and Latin terminology. So I would say that if you want to specialize in medical translation, yeah, and become a professional medical translator, one of the things you can do is to acquire all these Greek and Latin etymology, because that is going to be very useful in your future careers, and it's going to facilitate the understanding of words and also the translation of those words into another language. So this would be a case study. This is a case study we discuss in this article that I can send you, because now there's no time to go into it in any depth at all. Another example I have chosen is this concept of uptake, vaccine uptake. It's been around for many months now, right? This is a text I had to translate, and this is another interesting, very important. I'm sure you're aware about Cosnautas. It's a very important resource for medical translators. So we looked at uptake in this very important, very famous dictionary by Fernando Navarro, where he proposes solutions like captación, fijación, absorción, asimilación, or consumo. But in our case, none of them, would fit the context we were dealing with. So we looked at different monolingual dictionaries, like Merriam-Webster, Collins, or Cambridge dictionaries, and finally we came up with different possibilities to translate this expression, vaccine uptake: aprovechamiento de la vacuna, de la vacunación, aceptación de la vacuna, adopción de las vacunas, participación en los programas de vacunación, tasa de población vacunada, uso de las vacunas. So this is the sort of problem you come up when dealing with an expression like vaccine uptake. Uptake is not necessarily a highly specialized term. It's a general word, but can be very problematic. Finally, we looked at a dictionary of COVID-19, also published in Cosnautas, and we finally decided to translate as uso o utilización de la vacuna. So basically, in the first resource we looked at, which is a highly specialized resource, the different solutions did not match the context we were dealing with. Then we looked at monolingual dictionaries. We came up with different possibilities that could actually make sense in the text. And finally, we found a very adequate solution in this COVID-19 dictionary. What I'm trying to say with this example is that we need to be aware of all these highly specialized resources for the medical translator. And these resources are growing all the time. They are being created all the time, right? And through the pandemic, we've seen that there's been a growth, not only of texts, vocabularies, terminologies, and so on, but also of resources for translators. And this is one of them, this COVID-19 dictionary. The other example I was going to comment on was viral shedding, but I think we are very short of time now, and I will go quickly through it. Shedding, again, is an expression, is a word that can have different meanings depending on the medical specialty. Descamación in dermatology, menstruación in gynecology, muda in zoology, and so on. Plus eliminación, desprendimiento, caída, propagación, o dispersión. So just for shedding, we have something like 8, 9, 10 different possibilities. It does not mean that all of them are going to be relevant in the context we're dealing with. So finally, again, we looked at this glossary of COVID-19 and found out that for our text, excreción del virus was the solution, right? Was the real solution, was the good solution. And finally, when talking about problems, I would say that patient-centered translation can be problematic because writing for specific groups of patients requires a detailed knowledge of these readerships, and that is not always this knowledge is not always available. So sometimes we need to research, do some research on what kind of needs, what kind of preferences these specific groups of patients have. And intralingual translation is another problematic area that medical translators, health translators need to address and master. And by intralingual translation, I mean, again, adapting highly specialized texts to lay readerships like patients or the general public, right? There is a growing need for this type of intralingual translation or genre shift. Well, just to finish, I would like to say that we could look at these types of competencies and language and writing. And in language and writing, from the perspective of the medical and health translator, what I would say is that you need to master all these great variety of genres, of text genres that are used in different contexts, in different situations. Some of them are highly specialized. Some of them are at the service of communication among experts and so on. But some others are more in the field of doctor-patient communication, right? So, or patient-patient communication, actually. So we need to master specific genres, both highly specialized and non-specialized. In the area of communication and culture, I think we need to work on doctor-patient communication. Doctor-patient communication is a very important area, both for interpreters, mediators, and written translators. And here we need to be very much aware of different values, different beliefs about health, disease, well-being, and so on. Medical concepts, and as I mentioned before, we can work here towards specialization. We can work on etymologies. Yes, working on etymologies will be of great help, and working on good glossaries with useful definitions will be very important. Transference here what I would underline here is the difficulty of translating intralingually, the difficulty of adapting highly specialized texts for lay audiences. So we need to redefine what we need by transference and what we need actually by equivalence. Information resources, you need to be aware of the great richness of dictionaries, of textbooks, of journals that you can use to build up corpus if you want to test phraseology issues, terminology issues, stylistic issues, register issues, and so on. Professional practice, I would say here that yes, machine translation is growing a lot, but new needs are appearing at the same time. We need to keep an eye on all those new needs. And attitude, I would say we need to have a very proactive attitude as professionals in order to be able to communicate with other professionals in other disciplines that are relevant for our professional work. And I would insist on the idea of human agency in the era of machine translation and in the era of artificial intelligence. My proposal would be, focus on human agency in the use of technology and in the discovery of new needs in medical and health translation. Thank you very much.
Thank you. Thank you much, Vicente. That was excellent. That was a super interesting, very overarching presentation. I think it gave us like a very good idea of what is needed, like all the competences and all the challenges that the medical translator faces. And even beyond, you mentioned also areas like interpreting, right? And I think it was very interesting, all the different tasks that the translator, or like the, or we could call him like communicator, like medical communicator,
Yes.
ends up doing beyond translation, right? So I'm opening the floor for questions. We actually have a couple of comments on the chat, but I'll wait to see if anyone has like any questions. You can use the chat, or you can open your mics and ask. Questions, Miguel?
I can have a quick question. I mean, how my students are here. They can probably have better questions than me. But I have a quick question. Here in the US, we have mostly like, you know, a main language is English to Spanish, the direction of community translation in medical settings. And then there is another range of, depending on the area, of languages. What is the survey in the area where you, like, you know, the Comunidad Valenciana, for example, which are the main languages? If the direction, is it mostly immigration, tourism? Which languages are the main languages for medical translation, if you might say, within, so to compare here? Because here it's mostly community translations for minorities. What is the landscape there right now?
Well, in Spain, in the area where I live, as I was mentioning before, Spanish is an official language. Catalan is an official language. In the healthcare system, both are used, but I would describe that coexistence in terms of diglossia, which means, you know, an asymmetry between the two. So there is a dominant language, which is Spanish. There is a minoritized language, which is Catalan. That's one thing. That's one element. But then we have communities. We have communities from Romania, for example, in our area, which is a very important community, but also Arab communities and Chinese communities, and the healthcare system, I must say, does not cater for all those communities. So it's a highly monolingual situation, really, the healthcare system as it is now in Spain. And what I've seen throughout the pandemic is that in public health issues, it is still also very monolingual. So both within the hospital setting and in society at large, throughout the pandemic, I think the strategy has been more in monolingual terms. Of course, if you now move on to the more biomedical space, the other need is the translation from Spanish into English, because researchers want to publish their papers in international journals in English. Yeah,
excellent.
But I think there is a growing awareness of the importance of the patient's mother tongue, of the patient's native language, because there are more and more studies providing evidence that if the patient is not allowed, is not taken care of in her mother tongue, well, there is a risk that a lot of information may be missed or may be misunderstood, and that has consequences in adherence to treatment, in satisfaction of patients, and so on. So I think there is a growing awareness of the patient's mother tongue, and that means need for translation. Excellent. No matter which mother tongue is.
Thank you very, very much.
Thank you.
Thank you, Vicente. So I'm gonna mention like a couple of comments. Like Vanessa she had like a comment about the adaptation, right, to the readership. She says, for public health and patient education materials in English, the American Medical Association and the National Institutes of Health recommend the readability should not exceed a 6th level grade. I have seen translations prepared at a higher grade level than the English originals, with the effect of rendering the information useless to the general public. So there is like
Absolutely. Yes, absolutely. I absolutely agree. We've done some research on readability, and we've been using readability formulae. And I would like to say that readability formulae, they are useful. They can give you, you know, an overview of the problem, of the situation. But then you need, if you really want to understand how readers read and understand texts, you really need to have some sort of qualitative approach to the process. So, you know, interviews, focus groups help a lot. But in general, what we find is that readability is a big problem in materials addressed to patients and to general public. Of course, the issue here is, how do you make things, how do you make texts more readable? And this is a big issue for medical translators, medical and health translators. Of course, there's a lot of work in intralingual translation. I recommend authors like Sefsen in Denmark, in Aarhus University. She's done a lot of work on readability in genres for patients, for example, in patient information leaflets. And she suggests a number of strategies. But of course, one thing is strategies that make sense, like avoiding jargon, like avoiding long sentences and so on. But then you need to test those texts with real patients. You may actually achieve better readability through formula, but you may miss important points that readability formula don't really measure. For example, emotional aspects of words. Yeah? In cancer treatment, for example, treating the body as a container of chemical stuff, of chemical substances. We saw this in an experiment. The readability was fine, but there was an emotional issue that made the text really unreadable, not because readers did not understand, but because readers were put off by these sort of metaphors in the text. So I think, in addition to readability, when you're writing translations or original text for patients, you need to understand the emotional dimension of written communication and the cultural dimension of written communication.
Super interesting. It just actually reminded me, we had a student a couple of weeks ago. He's working as a coordinator of translation services in a healthcare facility. And he recommended that we also train students in writing medical communications and easy English, and adapting, you know, the texts to the readership, because there is such a gap sometimes between you know, what the doctors want to say, or what the healthcare facility wants to say, and what the patients actually are getting, or, you know, can read, or as you said before, emotionally can process.
Yeah.
So,
yeah,
very interesting. So just one, we don't have a lot of time. I'm just gonna mention like a interesting comment by Jan, and Christina has a question. Maybe, well, I mean, I think if anyone wants to leave, can leave. I mean, we can stay a couple of minutes more because I think there is interest. Jan, and then Christina has a question, and then I think we'll wrap it up. So Jan was saying, on a trip to Iceland, I learned that all medical terminology by law has to be translated into purely Icelandic forms, with no long words from other idioms allowed, or other languages. A nurse told me it makes recruiting from abroad very difficult. So I guess he's referring to the over translate, like, you know, like no like purely Icelandic form. So everything has to be translated, and what consequences that has to, you know, to recruit, I guess, doctors from abroad.
Well, yes, this is a big issue in many countries, as I was saying before, the mother tongue of the patient is really crucial for comprehensibility issues, but also for emotional issues. Patients are in a vulnerable position. Sometimes they are in shock, yeah? And it's very difficult for them to understand or express themselves in a language which is not their own language.
Mhm.
That particular clinical situation, that's one dimension I'm very interested in from the point of view of patient-centered care, right? Which is I think is the emerging force in many healthcare systems, and the dominant force in many Western healthcare systems. Of course, there's the other side, the other dimension. What is required from a health professional, from a doctor, from a nurse? Should they have communicative skills? Should they acquire communicative skills in their education, in their university education? Should they be able, should they have the knowledge and the skills to interact with a patient? Should the knowledge of the language of the patient be included within that cultural competence, that linguistic competence of the health professional? This is a crucial question, and as far as I can see, in Spain, there is more and more awareness of the need for health professionals to have these communicative skills, these cultural skills, in addition to their clinical and biomedical skills, yeah? Because in the end, they are dealing with patients. So what I can see is that in medical schools, this has not been sorted out properly yet. Even in more recent syllabuses, still absent. This communicative training is pretty absent. They are required to perform properly in a final exam, where they simulate interactions with the patients, yeah. But they still need more training during their educational years. So I would say, in summary, I understand that in Iceland or in other parts of the world, health authorities try to make sure that patients at least can express themselves in their mother tongue. Of course, you can imagine many contexts in which the patient expresses herself in her mother tongue and the doctor understands that language, but does not necessarily speak it. There is not necessarily fluent in it. So you can, for example, in my context, I can see many situations in which the patient can speak in Catalan and the doctor can answer in Spanish, and there's no problem there. Yeah, both of them understand each other. So it's a very tricky issue because when two languages coexist, they never coexist in equal terms. They never coexist in symmetrical terms. So yes, I can see the point that the Icelandic health authorities require this cultural competence, this linguistic competence from health professionals. The problem is that in their university education, they probably don't get it. This is the problem, yeah?
Yeah, very, very interesting point. I don't know if Christina wanted to ask a
Laura,
question. Yeah.
Sure. I have just a really quick question. Good afternoon, Professor Montal. Thank you so much. Your presentation is excellent. I was wondering, with all the different tasks that the translator interpreter has to do, one of the things that I didn't see listed was the role, and I'm curious to see the role of the professional as an advocate, because there's been many times where we acknowledge that in a particular field, like in cancer, there are no texts. Like my father, for instance, recently was diagnosed with prostate cancer, and there were no packets of information, absolutely, and not available in Spanish. And we see this as a problem still, but I was wondering, what are your thoughts on that as instead of having the client come to us to say there is a need for this, going the other way around, the professional bringing to light that there is this issue. What are your thoughts on that particular?
Absolutely. Thank you very much for this very important question. In fact, we have done some research to see what is the availability of materials for patients in hospitals. I mean, as a translator or as a translation-oriented researcher, you are interested in how ecosystems like a hospital work in terms of the availability of materials in different languages. So we found out that materials are not available in the target language of the patients, and through this research we've made health professionals aware of this niche. And one of the responses we've received so far is that they are aware of this, but they are not able to produce these materials. They need the expertise of linguists, they need the expertise of translators to produce these materials. So they somehow are also in a weak position as health professionals, because the system does not provide these multilingual materials to cater for the needs of different patients with different mother tongues. And yes, my personal position is that as translators and interpreters, and from translation studies, the translation studies perspective, one of our missions is to describe this lack of materials, this lack of information for specific groups of patients, in this case, prostate cancer patients. I mean, it's been proved, repeatedly that communication is a factor in health, right? So communication changes the perception of well-being. Communication affects the way patients interact and the way patients adhere and the way patients follow a treatment. So if communication fails, then healthcare fails as well. So there is a direct link between the two. So there's no point in not improving all communication aspects in a healthcare system. I mean, this has been very obvious throughout the pandemic. Without proper information, the population cannot change their attitude, their behavior, their habits in stopping the pandemic. So yes, absolutely right. Spanish in your context is a minoritized language, is not the dominant language. Therefore, by default, most of the materials will be, I guess, only in English or mainly in English. Is that the case?
Yes. In this particular scenario, it was. Yeah. But thank you so much for that. Appreciate it.
Thank you very much. Yes, and I think your question is very interesting as well, because it allows us to think of our profession in terms of what we can contribute to improve the healthcare system, what we can do to improve the communicative and cultural competence of health professionals as well. Yeah, so it's looking outwards, it's projecting what we can offer to the rest of society, rather than just limiting our research and our expertise to our own profession. I think we can do just what you've just mentioned. You detect, identify these problems and offer solutions.
Much, everyone. Thank you again, Professor Montaut, for the excellent talk. We have to finish here because there is another class that we have to continue. the class, like the presentation will be recorded. And if you have any questions for Professor Montal, I think his email is there. Otherwise, you can let me know and then I'll forward them to him, sorry. And yeah, thank you. Have a good evening. Have a good night, Professor Montal. I hope it didn't get too late. And
thank you very much.
Yeah, thank you very much, everyone. And I'll see you in the next talk that we will have. It's in April sometimes. You will get an email from me.
And for the students in my, thanks be sent in my class. We're gonna go back to the regular Zoom for the class, for the students in our class, okay? And thank you very much.